Hello, everybody, and welcome to the Operation Miss podcast, where we are tackling the maternal health crisis and helping moms survive pregnancy and thrive postpartum. I'm one of your co-hosts, Jessica Thompson. We also have Catherine here and a special guest, Laura. Catherine, how have you
Hey everyone.
Doing good today, and so excited to be here with Laura Driscoll, an amazing woman, a woman of faith, a woman who knows that we overcome not only by the blood of the Lamb, but by the word of our testimony. And so
Mhm.
she is here to share her testimony with us today so that she can empower women who were in situations like she was in, but she now has, she is at the light at the end of the tunnel. And so she's going to teach other women the way through. And so I fell in love with Laura a couple of weeks ago. I was so grateful that she ran up after a speech that I had given and told me her story. And since meeting her, I have shared her story with countless people so that they could understand that where sometimes the medical system makes it hard for you to have faith in your body and hope in the ability to overcome issues that arise in the body, that the designer didn't make any mistakes. And so there's nothing wrong with having hope. And there will be people along the way to support you and celebrate with you when the results of your faith come to fruition. So, Laura, please jump in, introduce yourself, tell our audience all about you. We are so excited to talk with you today.
Absolutely. Thank you so much for having me here, Jessica and Catherine. It's an honor to be here. As you said, I was able to meet you at the Emory White Coat ceremony where you were able to speak, and your speech was so inspirational. It definitely touched me, and I knew that I had to come speak with you because you definitely touched on the fact that we need to be our own advocates for our bodies. We know ourselves, and sometimes the medical community wants to put us in a box that we weren't designed for. So I definitely, like you said, I believe in a higher plan and a higher purpose. I think that God's timing and his planning are far better than ours. And my testimony is definitely an indicator of that. So I'm really excited to be here to share my story. It's been a long journey, and I'm definitely excited where it's going. I know God's hands are all over it. So I'm just excited to be on that journey and to share it with others. So just to give you a little bit of background about myself, I'm a 36-year-old woman. I live in Columbia, South Carolina. I'm a professional photographer, and I also have Stone's disease. So I have kidney stones. I was diagnosed at 21 years old with kidney stones, and unfortunately, that became a lifelong process and journey for me also, as I've had about 10 to 11 in my lifetime. And that is something that I've had to have surgery for. And because of that, I've had multiple CT scans. And in one CT scan in particular that I can remember back in 2012, there was a cyst that they noted on my scan on my ovary. I'm also prone to having ovarian cysts. I know a lot of us women have those. For me, they're extremely painful. And to back up even further, I've had extremely painful menstrual cycles my entire life, ever since I can remember. But that cyst, I was told not to worry about. As long as it goes away, it should be fine. I continued to have CT scans because of Stone's disease, and that cyst just kept showing up, and it seemed to be getting a little bit larger and a little bit larger every time. So at that point, my urologist referred me back to my gynecologist and said, we need to look into this cyst. It's not going away, and it seems to be getting larger. At that point, they determined that it was a dermoid cyst. And I should preface this by saying that I have absolutely no medical expertise. I have a training in graphic communications. I got my degree from Clemson and a minor in business administration. So absolutely no medical experience here. Everything that I'm sharing today is just from a patient's perspective and what was explained to me. So what was explained to me was that this was a dermoid cyst. And a dermoid cyst, in my understanding, is basically a mass of cells that can grow with different types of hair and basically it's just going to continue to grow and potentially cause a problem and needs to be medically removed, surgically removed. So in 2017, February of 2017, I underwent laparoscopic surgery to remove what they thought was a dermoid cyst. I got into the recovery room and I was told it was not a dermoid cyst, it was an endocyst or a chocolate cyst. I had never heard about an endocyst. And then my GYN told me you had stage 2 endometriosis. I discovered it while going in to get the cysts. So she said she burned the spots that she found, which is called ablation, if I recall correctly. She burned the spots and she took pictures and she gave me the pictures. And I was at a complete loss. Never, and at this point, I'm 31 years old, never heard about endometriosis in my life. There was some fear to it. I didn't know what it was. So I really relied on her to give me her expertise on what it was and how to treat it. And what was explained to me was that I needed to get an injection called Lupron Depot, and it was going to cost me about $3,000, maybe $3,500. And it was going to essentially give me the feeling of menopause. So it's going to put me through the symptoms of menopause, hot flashes, just the non-fun part of menopause. And but I was told that that was a temporary solution for my disease. And when I asked, because of course I didn't want temporary, when I asked what would be the way to get full relief, I was told that a total hysterectomy would be the way to go. I was 31 years old, unmarried. I knew that I wanted children, and I knew I wanted that for my future. So luckily, I was able to seek a second opinion, and the Lord blessed me by bringing Dr. Travis McCoy. He's an endocrinologist with Piedmont Reproductive Endocrinology Group, PREG. Located, there's an office here in Columbia, South Carolina. I know there's also an office in Greenville and Asheville. And luckily, I was able to go to him. I showed him my operation, the photos that she had taken during the operation. And he said, absolutely. And I told him that she wanted me to do Lupron Depot and talk about a total hysterectomy. And I told him I absolutely just did not want that. And he said, do you want children? I said, I 100% want children. I want a family one day. I want to be able to have that for my future. So he said, absolutely not. Do not do Lupron Depot. He looked at my surgical photos and he said, unfortunately, I actually think that you have more endometriosis that's present here that she did not identify. The spots that she burned, there's actually more endometriosis beyond what she found. I feel like what we need to do at this point is go in and do what's called excision surgery. So he didn't believe in burning the spots. He believed that you needed to cut the endometriosis out like with margins, kind of like cancer. So you've got to cut the whole part out. And I should stop here and say that endometriosis from a non-medical person, as it was explained to me, is basically the lining of the uterus that should be growing inside. That tissue is growing outside where it shouldn't be growing. And what happens, and for me, especially from a personal experience, when you go through your menstrual cycle, it flares up and it's extremely painful. I have had extremely painful periods my entire life. I started having my periods when I was 12 years old. They were extremely heavy, extremely painful. And when I sought medical attention at that time, I was just told it was common to have pain with menstrual cycles and to take Tylenol, use heating pads, and basically just push through it. That's every woman has to experience this. It's just part of being a woman. You just have to kind of grit your teeth and bear it. When I was 19 years old, I discovered birth control, and the fact that I could take continual birth control and not have a period, which was the best news that I'd ever found. That was just something that apparently for me, my body was able to do. I know not every woman is able to take continual birth control and not have menstrual cycles, but for me, at 19 years old, when I discovered that I could do that, I immediately started doing it. And unbeknownst to me, it was actually the best thing that I could do for myself. So when I met Dr. Travis McCoy and he started telling me what endometriosis was and the way that we needed to treat it, which was to cut it out. And I had told him that I had been doing this continual birth control. He said, you, without even knowing it, were doing the best thing for your body, because it was keeping the disease at bay, because I wasn't experiencing that extremely painful cycle when I was able to do the continual birth control. So he also, Dr. Travis McCoy, again, huge shout out. I send everybody his way because he has just been a blessing to me. This was in 2017 when I found him. I had had that ablation surgery in February. He was able to get me into surgery in December of 2017, and he did laparoscopic robotic surgery in Greenville, South Carolina. And he was able to cut more out. And he also discovered that my appendix had been fully compromised with endometriosis. So he did an appendectomy while he was in there to save me from having appendicitis in the near future. When I came out of surgery, he told me that I did not have stage 2 endometriosis. I had stage 4 endometriosis because it had spread to other organs. And it was more extensive than what was originally diagnosed. So when he was able to go in and cut out the disease, I did have immediate relief following the surgery. It was incredible. He had me go back into the continual birth control so that I was back to not having menstrual cycles. He also, and I will say, side note here, he's just a wonderful, wonderful doctor all the way around, because when I first saw him, the first thing he said was, we need to make sure that you are hormonally able to have children, because he works in an infertility clinic, PREG. Most of the patients that go to PREG, Piedmont Reproductive Endocrinology Group, are seeking fertility treatments. And so he said, let's do a hormone test to make sure that your hormones are where they are, because he said, the worst thing that I see is women coming in and they've missed their window. And he said, he's like, I know you haven't met the person that you want to start with your family with, but I want to make sure that you still have that window, because we might need to talk about harvesting eggs. So again, side note there, Dr. Travis McCoy was just a godsend to me and a blessing. And thank goodness I found him, and I didn't go the way of the original doctor who was trying to lead me down becoming sterile at in my opinion, an early age, early 30s. So I continued with Dr. Travis McCoy. He said, when you're ready, the hormone test came back fine. He's like, you're absolutely within that window to have babies. So praise the Lord, that was wonderful. And yeah, so again, I just feel like he saw me like a whole person, which just felt wonderful. But he told me, he said, when you are ready to have children, the first thing we need to do is to get your partner in here, and we need to make sure that he doesn't have any issues, because when you go off of your continual birth control, that's when the disease is going to start coming back. That's when you're going to start experiencing that pain again. So we want to make sure that we make that the foundation is ready, and then we'll have you go into it. So that was in 2017. The Lord brought my husband into my life in 2018. And in 2019, in 2019, we were engaged. And I actually had the conversation with him up front with my husband. I said, if we want to have children, we need to start early. And actually, I'm a very forward, blunt, and open and honest person. So when my husband and I started getting very serious, I had to talk with him, and I said, where do you see yourself in 5 years? And he said, now, and I will say my husband's 4 years younger than me. So I was 31 at the time. So he was in his late 20s. And he said, well, I see myself in the same job, in the same home. He said, but definitely not married, and definitely not with children. Now, we were just dating. We had only been dating now for a couple of months when things were starting to get serious. So I said, okay. And he said, why? Where do you see yourself in 5 years? And I said, well, I see myself married and with children, and, in a church, and stable and in a happy, loving relationship. I said, now I know we just met. I'm not asking you to marry me. We're still getting to know each other. I said, but we do need to, in maybe 6 months, I said, I'll give you the consistency that you're looking for. But in 6 months, we need to kind of revisit this question. And if you still don't see, yourself married and with children, that's fine. I just know that I need to move on and continue on, and we'll just part there. Mm-hmm. So 6 months later came about, and this was the middle of 2019. And I said, "Hey, Aaron, where do you see yourself in 5 years?" And he said, "Laura, I didn't think that I would find the woman that you are as soon as I did." He said, "You're wonderful. I see myself married to you. I see myself having children with you." So I said, "Well, that's great. Let's keep going." So, and at the end of that year, we got engaged. He took me to Denver, Colorado. We got engaged in the mountains, and it was beautiful. And we started talking about our family. And I told him, I said, as soon as we can, I said, we just need to make sure that everything's good with you, because I have to come off of the medication that basically keeps my disease at bay. And he was totally fine with it. So he got checked. He's fine. And so what we did was we decided to try for 6 months without any intervention. And this was we got married in 2020. So we immediately started in 2020 trying to get pregnant. And at that time, I will say Dr. Travis McCoy, he had moved to the Asheville office. So when I came back, I actually came back to Preg saying, okay, I'm ready to get pregnant now. And I know that I'm going to have an issue with stage 4 endometriosis. They said they paired me with a local doctor, which was fine. So I started working with a local doctor. And the idea was that we would try for 6 months to conceive without any help. And when 6 months came along and we still were not pregnant, we started doing hormone therapy. So I started taking letrozole. I think there's another medication, starts with a C, Claudin or Collodin, that they didn't want to put me on. Have you heard of that?
Mm-hmm.
Yeah, okay, good. They didn't want to put me on that because of my endometriosis. So they put me on letrozole. And I started taking oral letrozole and also trying. We tried that for a few cycles and it did not work. So then we went into IUI, which is basically when they take the male sample and they then put it directly into the uterus. That did not work. And I will say, backing up, they tested me to make sure that my ovaries were open. So that was a test where they did that in the office and my ovaries were open. So praise God, that was a good thing. But then we did IUI and that did not work. And the local doctor started talking to us about IVF. My husband and I decided that was not what was for us. IVF, in vitro fertilization, is when they actually create embryos and then they implant that into the uterus. Correct me if I'm wrong here. It's an extremely expensive and invasive procedure. And I never really considered the fact that multiple embryos would be created. Typically, I think what it was described to me is sometimes they would do maybe 10, and then you would decide how many are put into you. And then once you get pregnant, you could potentially have other embryos that are still there, still viable embryos. So they actually talked to us about adopting other couples' embryos. Never heard of that before either. That was the first time I'd ever experienced that. We were okay with that, but it wasn't, again, IVF just wasn't something that we felt called to do. At the same time, we were starting to face the fact that perhaps we weren't going to get pregnant. Perhaps this wasn't what was for us. Maybe the Lord was calling us to adoption. So we reached out to the local adoption agencies here in South Carolina. And when I spoke with the state, I was kind of met with some interesting response in that if we wanted to adopt, we had to be willing to take teenage siblings, like a pair. And Aaron, my husband and I, we've never been parents, and we didn't really feel well equipped enough to jump directly into teenage siblings. So that kind of started to seem like maybe that wasn't the best option for us. And at the same time, meeting with this doctor, the local doctor with Preg, who was telling us that IVF seemed to be our best bet. She started to say some things that didn't really sit well with my soul. It felt like a little bit of a pressure to do IVF. She told me that the definition of insanity is doing something multiple times and expecting different results. Which I found to be a very interesting thing to say to women who are going to an infertility clinic and are struggling for years to get pregnant. So I honestly decided to part ways with that doctor.
Mhm.
And when I spoke to the office manager and I told her how I just had a wonderful experience with Dr. McCoy years ago, she said, well, you could still be a patient of his. And I said, well, I know he's in Asheville and I'm in Columbia, South Carolina, and that's quite a distance to travel. I was told, no, actually, you can still be a patient of his. He can talk with you over the phone, and we can treat you here, and he can watch your records there, and you can be his patient. I had no idea that that had been an option. I was thrilled when I found that out in December of last year.
Mhm.
So I set up that consultation with Dr. McCoy in December of last year. And when he got on the phone, he said, Laura, he said, I had no idea you were coming back. I didn't know that you were ready to start your pregnancy journey. I'm so thrilled that you're here. I'm so thrilled to be talking to you. We spoke for an hour. I absolutely love Dr. Travis McCoy.
Mhm.
He looked at my chart and we talked about everything that had happened. And he said, Laura, he said, I hate to tell you this, but I don't feel like the IUI situation was what needed to be done for you. He said, I'm looking at your chart. It seems that you've had some cycles that went on the verge of 40 days, because there were times where I had to actually have medical intervention with pills with medication to start some of my periods when I was trying to have a child. And he said, I don't think the problem is necessarily anything that has to do with IUI, like where everything's meeting. He's like, I think that you also, on top of stage 4 endometriosis, I feel like you have PCOS. And I said, well, I've never been diagnosed with PCOS before. Tell me a little bit more about it. And he said, I think you have the form that is a little less common, where basically your body's not ovulating the way that it's supposed to. So what we need to do is we need to make sure your body is ovulating and releasing that egg. And I want to make sure that you're doing that on a consistent basis, through going back to the hormone therapy, so that we can make sure that everything is happening the way that it should be. So now not only do I have stage 4 endometriosis, but I also have PCOS, both of which are extremely difficult to become pregnant.
Yeah.
We decided to start doing, that was January of this year, but went back to letrozole. And what they were doing was they were having me do letrozole. I would go in on day 12 of my cycle. I would have a transvaginal ultrasound to make sure that I was ovulating. They would tell me how many follicles were there, which is what we had done a year and a half ago, but only for 3 cycles. And then I would actually do a shot of Ovidril. So Ovidril is a shot that basically triggers the ovulation. So once they determined that the follicles are ready to go, they would tell me a specific time to come home and give myself an injection. I should stop there and say that my husband is not thrilled with any sort of needles or medical or anything like that. So when I first had to give myself shots, I was a little scared for myself as well. Like, giving myself a shot seemed kind of scary. I will say that my mother is a nurse, and she helped me kind of. In the beginning, she would give me the shots. And so then, but there were times where I'd have to do it at like 3 a.m. And so she taught me how. And so my husband would watch me and he's like, how are you doing that? And I said, when you want something bad enough, you're just gonna do it. And it's not that bad. Once you kind of get over that initial fear, it's not that bad. So any women that are having to give themselves injections for any type of fertility treatment, I've been there, I get it, I know it. So we are strong, and we can rise above it. So
Can I interject for a second?
Absolutely.
Because we've shared so much already. I just want to ask some questions. Then want to go back.
Yeah.
So you said that your favorite doctor left, and then you went back and they said to try on your own for 6 months. What did that 6 months look like? Did you get any education about when to try? What time of the month would be the best time to try to get pregnant for you? Or what time of your cycle, or things to kind of look for to know this would be the best time to try to get pregnant or to have sex? Did you get any education in that 6 months?
No, honestly, I had absolutely no education. I asked questions like, is there a better time of day? Is there a better time, of the month? And I was just told, nope, it's just gonna happen when it happens. You just kind of have to not think about it, not stress about it, just kind of go, just do it. And no, I wasn't given any kind of education on what to look for in my body or different things that I could do to tell if it was something that would be an ideal situation. I honestly didn't even learn about ovulation test strips at home until maybe a year after that, when we got more into trying. I didn't even know I could do that. But yeah, apparently you can go to the store and you can buy ovulation strips, and I had no idea.
Yeah. And those are not always the greatest, but it is an option, And so you did that for 6 months, just not stressing and just trying, because that's what they told you to do. And then after that, you went back, and then they started to do the IUI.
Yes. So basically, I didn't hear from them for about 6 months. They basically, they sent me on my way, and they said, all right, you just go try for 6 months. And then when it doesn't happen, you just come back to us.
Yeah.
So yeah, no type of education, no direction on what to do or how to do it, just, go try and then come back to us when it doesn't work.
So emotionally though, 6 months, I mean, that's a long time. To be thinking that you're doing everything that you can because that's what you were told. I mean, how did you feel over that? How did y'all feel? Both of y'all feel over that 6 months?
It was difficult. I will say that my mother's family didn't struggle with infertility, so there was a lot of hope. And you're just gonna get pregnant immediately. Don't worry about it. Like, you're just gonna, give it a month or two and you'll just get pregnant. So, I mean, we were hopeful. We thought that, okay, well, there's nothing that in both of our families that indicate that there would be any sort of issue, other than the fact that I was diagnosed with endometriosis, and nobody else in my family has been at this point. But no, I mean, we were very hopeful. It was extremely discouraging when the 6 months came and went and nothing happened. I will say that it became even more of a it made me feel more defeated as the months went on. You want to start a family so bad, and you're in the right situation, and you just feel like, oh well, now's the time. But definitely with my situation and what I've learned is that it's not my timing, it's God's timing. And I definitely think that now that I'm at the end of this, as Catherine said, I'm kind of towards the end. It definitely is just, it's a story that I just know that God has just created from the very beginning. So
yeah, that's so good. That's so good. And I hate that you had to feel defeated in that process, because I just feel like education was the missing link. And just the way that you speak about your process so thoroughly, like, you are the ideal patient to educate on what's going on in your body, because you can handle it, you can understand it. I mean, and everyone can, you just have to educate people in different ways. But I feel like if you would have got that education piece on, how to detect, like, if you are ovulating throughout the month, what your favorite doctor found, like the year later, however long later, they could have figured that out sooner.
Absolutely.
If you would have known to check your cervical fluid and your body temperature and all, they would have found that out within that 6 months.
Absolutely. I mean, the thing that just blows my mind really is that had I not had Stone's disease and the kidney stones that led me to these CT scans, I don't know if I would have ever even been diagnosed with endometriosis to this day. It's so unfortunate. They say that 1 in 10 women have endometriosis, but they say they think the number's higher, far higher, because of the fact that these women aren't getting diagnosed. I mean, again, I don't know if I would have been had I not had kidney stones and these CT scans that led to what they thought was a dermoid cyst. So it's just, it's an incredible, it just seems like an incredible loss, and definitely an opportunity for improvement in the medical community, definitely in terms of education. I will say that at the same time of getting back in touch with Dr. Travis McCoy in December, I was scrolling through social media and I found out about pelvic floor physical therapy. I had never heard about pelvic floor physical therapy prior to just happening to fall upon it in my social media.
Yeah.
So when I saw that it could help with endometriosis, I immediately started doing research. And in our area, there's really not that many specialists. But luckily, again, a godsend to me was Megan Davidson. She's a doctor of physical therapy, and she has her own pelvic floor physical therapy practice here in Columbia, South Carolina. And I reached out to her and I just said, hey, like, just kind of found out about this, would love to just come speak to you about it and learn more. And so I was able to see her in December, and we started to talk, and she said, you know, I told her my issues. I had pain with menstrual cycles. And at this point, it had been going on 2 years of trying to get pregnant. So I was experiencing the pain again of the menstrual cycles, and it was extremely, excruciating. It's a very painful process. So when I spoke with her, she did an initial internal assessment, and she said, your pelvic floor is extremely tight. She said, and she said, basically, when you're in this constant state of just tension, she's like, it's like you're walking around with your bicep curled all of the time.
Yeah.
She said, I'm not saying that that's why you're struggling to get pregnant, but when your body's in a constant state of this fight, because, you know, fight or flight, and you're in this constant tension, it makes sense that your body would be pushing out any sort of external, you know, invasions. It could see it as an invasion. Basically, your body's just in this constant state of fighting. So she said, what we need to do is we need to teach you how to relax your pelvic floor. Through diaphragmatic breathing, through stretching, through all of these different practices. She's like, we just need to get you to that state where you're in this good state. Your pelvic floor is in this rest, so that your body can allow to have, you know, allow the possibility of a pregnancy. So amazing. Another godsend, 100%. I sing her praises from the rooftop every chance that I get. I feel like every woman deserves or should be going to pelvic floor physical therapy. There's so much that it can help with, and not just women, men also. But she definitely educated me on my pelvic floor and how to relax. I've made tremendous progress being able to see her. And I will say that I absolutely love it. I in a way, I am a little disappointed in the medical community for not teaching me about pelvic floor physical therapy. Again, the only reason I found out about pelvic floor physical therapy was because of social media. So, you know, with the diagnosis of endometriosis that I had had for 6 years, why did nobody say anything about pelvic floor physical therapy? You know, it seemed like the answer for me was pharmaceutical drugs to manage my pain. And, you know, I unfortunately just think that the medical community can be driven a lot by pharmaceutical companies. And it's just extremely unfortunate, because I feel like our bodies are created to handle situations like this, is when we are educated in how to use the body, how to work with our body, how to not work against it, but to figure out where the source of the problem is, and to be able to work on that holistically, as opposed to just knee-jerking into the medicines and the drugs and the chemicals. So yeah, pelvic floor physical therapy also came into my life in December. Wonderful, absolutely wonderful person. I highly recommend Megan Davidson and pelvic floor physical therapy. So.
Okay, Laura. Just wonderful. What I want to say is, we've learned so much just in listening to you. And as women, Jessica and I feel that if we can just create the right environment, then women can thrive. And what you've done since you were a teenager was fight to create an environment where the baby that is now inside of you can live and grow and then be healthy and be born. The problem that we see is that a lot of women don't have the time, they don't have the resources, they might not have the education, they don't have the family support. And so when all of those things are stripped away and they end up at 50 saying, I wish I could have children.
Mhm.
And so we are grateful as we continue talking with you. We're so grateful that you are talking about the extent of your journey so that people understand we don't have to listen to the first diagnosis that's given to us. We can seek a second opinion. We don't just need fertility doctors. Some people don't even know that endocrinologists need to be a part of that team. They also don't know the role that physical therapy can play and other healthcare providers. And then honestly, it is faith, but it's also work. Like you have to work and do the things that need to be done to get pregnant sometimes. Sometimes it's not as easy as people think it is. In terms of the tracking, so we love for women, and please, if you're listening to this episode and do not know how to do this, to track your fertility, Jessica mentioned cervical fluid, so like what is coming out of your vagina throughout the month, your temperature, we use a smart device to track that fight or flight that you were talking about. And so if women are not aware that they are in a constant state of fight or flight when their bodies should be in a relaxed position, and we're able to track there. And so there are just different things and then cervical position where someone can put a finger inside of their vagina, figure out where their cervix is, if it's open, if it's closed. And those are just ways that are things that you can do at home, and you can know how long are your cycles. Am I actually ovulating? If my hormone levels getting high enough to sustain a pregnancy? Am I getting pregnant and then losing the baby? There are so many things that we can find if we can just commit the time. So can you tell us, was there somewhere along the way where it became overwhelming from a time commitment standpoint or from a stress standpoint? And what did you do about that for the women listening who may be in the same situation that you're in?
Yeah, actually, that's a wonderful question. That all came to a head for us at the beginning of this year. So even though we had been blessed in December to find Dr. Travis McCoy and also my pelvic floor physical therapist, in February, I decided that it was just a little too much. I was experiencing stress on my job, the one that I had mentioned I had been with for 14 years. I was experiencing just overwhelming stress with, even though Dr. McCoy wanted us to do the hormonal therapy, I'm getting older. I'm 36 years old, about to be 37 this year. And it was just the time started to feel like a little bit of a pressure. And it just all came to a head for me in February. At that point, and also monetarily, let's talk about the money. The money behind this, we had now invested thousands into fertility. What I was doing, even with the hormone therapy every month, I was taking the hormones. I was doing a $200 ultrasound and also a $200 shot. So, I mean, essentially every month for me was about $500. And I mean, that adds up
quick.
Just became one of those, definitely, it was definitely God telling me to reduce the stress in my life. I felt that calling. I felt that God had been telling me for months, if not longer, to step away from the job that I had been in. That was just causing a ridiculous amount of stress, and stress on the body just has all types of adverse effects, 100%. And so God, when you don't listen, he'll throw a little pebble at you, then he throws a rock, and then when you don't listen, he throws a boulder at you. Yeah, that boulder came for me in February, and I said, okay, God, okay, like I hear you. I couldn't hear you any louder. He was speaking to me through the people around me, through the situations that were occurring, and just through his word. And I just was like, okay, God, okay, I'm going to step back and step out on faith. So in February, I actually quit my job of 14 years. And I switched into focusing onto my photography. I also told my husband that I felt like my body was telling me it just needed to be reset. So I also stepped away from the fertility clinic. I did continue to take letrozole for 5 days of my cycle, which was day 3 through 8. But at that point, I got into tracking my cycles a little bit more closely. So I was seeing that it was 28 days. So I knew that I was ovulating when I needed to ovulate. And I was also ovulating around day 12 or 13.
Wow.
But I did want to take the stress off of my husband and I. So it was more of, let's be together, out of love and less out of obligation. It becomes a job after a while when you're trying so hard to get pregnant. So I told my husband, I said, I just would prefer to step away from the fertility clinic at this time in February. I want to continue to take the letrozole because I do understand that my body has trouble ovulating. But when I saw that my cycles were staying a consistent 28 days, I knew that I was ovulating. So I felt like that was a hope. There was a silver lining here. I also had strong support from family and friends. A good friend of mine in Greenville, she said, I know this is going to sound silly. She's like, but I want you just to get in front of the mirror and I want you to just touch your belly. And I just want you to just say, like, you will be pregnant. You're going to be pregnant. I think that mentally we can get into our heads, especially as women. And when we just get, at this point, I've had 40 negative pregnancy tests or more. It just becomes like a defeated, like, no, I'm not going to get pregnant. I'm not going to get pregnant. No, it's not going to happen. Like it's not going to happen. So I started trying to change my mentality as well. And I said, okay, I'm going to get pregnant. And I just kept telling myself, this is going to happen. Like, I'm creating the environment in which, a life can be brought in God's timing. So that was in February. I tracked my cycles, 28 days. And I should say, side note here, my husband and I, we were both baptized as infants. I grew up in the church. We both have a strong Christian background. And in this time, I was doing a study with John MacArthur study, and we felt like the Holy Spirit was telling us to get baptized as adults. So on May 22nd of this year, my husband and I were baptized at our church, which is Radius Church, and we celebrated, and it was a beautiful moment. And then I will say I have this app on my phone that tells me when to take a test. And on May 31st, it said time to take a test. And I was just like, oh, I don't want to, but okay, in God's timing, I'll go ahead and take a test. And it popped positive immediately on May 31st.
Wow.
And which meant that I was pregnant during my baptism and had no idea, but God knew. So I think that that's a beautiful story. It's definitely part of my testament, just being faithful and relying on his time and his plan, far better than ours and my own for sure. So was so excited to receive that news. Today, I'm pleased to announce that I am 23 weeks pregnant.
Yeah.
With a baby boy. Yeah. And super excited about that. We're doing what we need to do. I am a huge proponent of being your own health advocate. So I've already found a doula who's going to help me with a hospital delivery. And I think
up and run and dance right now.
So I told her, I was like, I can sit here and I can plan what I want for my birth, my whole birth process. I know that things can happen and things can change on the day of, but on the day of birth, I want to focus on giving birth and breathing and relaxing and allowing my body to do what it needs to do. So I'm not going to be able to be that strong health advocate. I'm not going to be able to speak, and say my birth plan. So, and my husband needs to be beside me, supporting me spiritually, supporting me emotionally. So I don't want him to have to, be on guard as well. So I'm super excited to have my doula with me, and she's going to basically be the person that I'm going to point to whenever they tell me, like, you're 10 centimeters and you're ready, let's push. And I'm going to point to her, and she's going to say, what is baby station? Because I'm not going to be able to say that. She's going to say that. Or, if they start to say, well, we need to go to a C-section, I'm going to point to her and she's going to say, is it medically necessary? Why is it medically necessary? And then, they've already started talking to me about possibly having to be induced. I'm also going to point to her where she's going to say, is it medically necessary? And also if for some reason we do go into Pitocin, I'm going to point to her and tell her that, she's going to be the one that's going to say, reduce the Pitocin, let her body do what it needs to do if I feel like I get to that stage where it's too much. So I'm learning.
Wait. This is so good. This is so good. This is so good. Okay, I have two questions for you though.
Sure.
And this is something, actually, let's just say this. Jessica and I, to this point, have monitored 75 women, so in different phases of their pregnancy or their motherhood journey, excuse me. And for the three that agreed to, well, two of them agreed to an induction and one agreed to an elective C-section with pressure. So not with medical support. And of course, against our recommendations, but we love all of our Miss Moms and we support whatever decisions that they make. So all we want is to give them all of the information that they need so that they can make a decision that they can live with. That is our entire goal. And so at the end of the day, whatever decision they make, we support. But what I would say is those three moms dealt with complications following the delivery, and two of them hemorrhaged. So they bled too much after delivery because and then they're told, your uterus is just not doing what it's supposed to do. No, my uterus is being forced to do something that it wasn't ready to do. There's a difference. And so at 23 weeks, I don't understand why an induction would even be discussed. Honestly, and this is just, you've been tracking your cycle, your due dates and everything like that. But even if 40 weeks came knocking at the door with no medical reason, why would there be an induction? And so women just need to understand, although inductions are common now, they're more routine, the carrot is dangled. Aren't you tired of being pregnant? You want to meet your baby sooner. I've never heard so many positive invitations. Like, if a medical professional, in my opinion, is offering you all of these things that sound great, I'm just turning around and going the other way, because the thing that is great about pregnancy is that you have a baby growing inside of you and you had no control over any of it. And I think that if we understand that part, there's nothing that we could do outside of having sex for the baby to be conceived. Then why do we think that if all throughout the pregnancy, we're not doing anything for the baby to get nourishment and to develop the way that it does, other than what we're consuming, then why do we think we all of a sudden need to take control back from the designer at 39 weeks, at 40 weeks? It is a scary situation, I think, for women to be placed in. A lot of times it's a high pressure situation. There may not be people around them. Our Miss Moms are completely supported and encouraged and everything, but there are some people who are not. And so they don't have the people around them saying, just wait until the baby comes. Sometimes they have people saying, well, I'm ready to meet the baby too. Well, I already took off of work to help take care of you. I was supposed to be bringing meals this week, and now I don't know if I'm going to be able to do it. So then as the mom, she feels pressure to follow what the medical system's trend has become, but then to her own detriment. Because when you lose half of your body's supply of blood, or 25% of your body's supply of blood, because blood carries oxygen, now you're not getting the oxygen that you need to survive. So that baby that you carried, that you fought for, could possibly be separated from you. You possibly lose your life, and it's just not worth it. Not for a week. I'm like, we could do anything for a week. We can't carry a baby for one more week when we get to the end. And so I really am grateful that you brought up that the conversations about inductions were being had now, because I think that women think that they'll encounter that later on and they'll deal with it later on. But no, you have a plan in place now because you realize what you could encounter later. But the questions that I have for you, number one, why did you choose an OBGYN instead of a midwife? And then two, well, let's start with that. Let's start with that one. Why did you choose?
Sure. Yeah, so I honestly wasn't really familiar with midwives until I got pregnant. And when I was looking into what would potentially be the best care for me, the midwife program that they have here in Columbia, South Carolina with Prisma Health, it was told to me that they're part of the same hospital, but they're a different group. So whether it's like a different wing of the hospital or a different building in the hospital, if any complication arose, let's say like a C-section, I would then have to be transferred into the OBGYN to labor and delivery with the main hospital. And I think that situation just made me a little apprehensive. I will say that my own mother had a C-section. I'm her only child. So the reality of a C, knowing what a C-section is, knowing that it's a real possibility, and just kind of that just made me a little apprehensive. And I'm one of those people that I would prefer to know the doctors that are going to potentially have to do that if that does arise. So the best situation for me kind of felt like this kind of middle ground where I would have an OBGYN, but I would also have a doula.
Yeah.
So in my opinion, my doula is going to act on behalf of being my advocate. I do want to be completely fully educated and know my rights. I don't want to be pushed around by a doctor on the day of or the day before. I will say that the reason why induction has already been discussed with me, and it was actually discussed with me at my 16-week appointment. So that's the first time induction was kind of discussed at my 16-week appointment, was because I supposedly have high blood pressure issues. And the fear is with preeclampsia. So I will say that I monitor my blood pressure at home. I have a blood pressure cuff that I use, and my typical blood pressure is like 124/76. I was told that that is high for a pregnant woman. I feel like that's actually a really good pressure. I will say that I have in the past had hypertension when I was on that continual birth control, which is I've heard is very common for women when they're on continual birth control. And it got to the point prior to getting pregnant during those years of being on continual birth control and having hypertension in my mid-20s that I was actually put on hypertension medication. So I know blood pressure because I've had it. When I came off of the birth control to get pregnant, and when I found a stable relationship with my husband, my blood pressure came down. So we were able to get off. I was able to get off of the hypertension medication. So I know blood pressure. So 124/76 doesn't seem that bad for me. That's what I average, but I was told that typically in a first trimester pregnancy, it should be lower than that. So the doctor did at that point say, we're not going to do anything to intervene in terms of any sort of medication at this point. We're just going to keep a close eye on it. But that could potentially lead to an induction because of the issue of possible preeclampsia. So that's why induction was discussed with me at week 16.
So Laura,
yeah.
So number one for the blood pressure, and two, let's go back. Inductions and C-sections, we're not anti those. We're anti those when they're unnecessary. So I had an induction for my last delivery, and it was a natural induction. Still had my baby at home, no medication, just different things that could be done to stimulate the hormones that needed to increase to start the labor. So we're not anti-induction or C-section. We just want there to be a reason. And what research is showing is that even though C-section rates are going up and induction rates are going up, the outcomes are no better. So we just want to make sure we say that so that women who are in that situation don't feel like, well, I'm never going to have one. No, you just don't want one without a reason. You have to weigh out the benefits and the risks. But with blood pressure, the education that we just want to drop in here for any women who are dealing with what is considered to be true high blood pressure, we'll get to that. Just remember that during pregnancy, you need to support your kidneys more. The kidneys help regulate blood pressure. And so hydrating well, drinking that, half your body weight in ounces in water as you grow matters. So if you were a certain weight in the beginning, you cut that in half, drink that amount in water, but then we gain weight throughout the pregnancy. So continue to drink more. Resting at least 6 hours a night, 5 or 6 hours a night, hopefully longer. It allows the blood pressure to drop by about 20%. And so we are able to make sure that our organs are getting the rest that they need when we're sleeping, if we'll sleep long enough. In terms of diet, just making sure to take in a lot of vegetables, not do so much meat all throughout the day, meat-based protein that can help regulate the blood pressure, keep the inflammation down or in the arteries. And so that way the blood pressure can stay lower. And then, yes, there is a trend for blood pressure to be lower during pregnancy, and then it go back up to normal during, toward the end of the pregnancy. So maybe around week 40. And so the thing that women need to know is if they have an understanding of their baseline and they're checking their blood pressures every day, then they can catch things between office visits as opposed to waiting from month to month, bi-weekly, and then every week. They can be tracking like you are so that they stay ahead of the problem and then make the decision when it comes. Not having a cloud of worry over them throughout the pregnancy, but realizing that they have more control than they think. And then in terms of salt intake, we're not anti-salt. Our bodies need salt. But what we do recommend is that you don't do the frozen foods that have a lot of salt in them or eat out, excessively throughout the week, because that's where we can get our entire day's worth of salt in one meal. And so that can drive up blood pressure. And then keeping down stress. You've already made the change where you followed what you were being told to do to minimize your stress. So those are 5 things that you can do while you're going through your pregnancy to keep your blood pressure down. And I know that you may know these things, but we just want to make sure we put them out there so that people don't feel like I'm just waiting on preeclampsia to come. No, you can do what you need to do to keep your pressure down, because at the end of the day, the blood pressure increase is a lot of times due to placental issues. So if they've not identified any placental issues in you and you are already at 23 weeks, then I'm just wondering where the concern is. But also just you having tools so that you can make educated decisions so that even if your blood pressure is not as low as what they think it should be, you're not allowing it or causing it to go up by lifestyle choices.
Yeah, absolutely. No, and I definitely appreciate that. And again, I'm a huge proponent of just educating yourself, learning your body, knowing that we don't all fit in a standard box. Every woman's different. Every pregnancy is different. So definitely just getting that education and listening to your body. I'm grateful that you're definitely pointing these things out.
Yay, because high is relative, low is relative. We have women who come on, their blood pressures are 90 over 50, 100 over 60. And they say, is that low? It's like, has it been that way your whole life? That's normal for you. So then we're looking at the deviation from your baseline. And that's the whole purpose behind Operation Mist, is looking at women as individuals, not looking at a standard or a protocol and saying, this is what we're going to do. These are the decisions that we're going to make based off of this. We're just making them based off of you. And so good for you for advocating for yourself, for investing even more money, right? So you've invested a lot of money already on the front end, but now hey, I need some people on my team to make this the best outcome possible. And you're putting your money where your mouth is. What is great in Georgia is that they now have a doula, Georgia Mama Care program, where women can have access to virtual doulas and nutritionists and lactation consultants. And so we just need more of that so that people can afford to have the help that they need, so that they don't have to push their partner into a role that they are not prepared to fill, or take on a role that they should not. You should never have to fight on the day of your delivery. So good for you for putting the right people in place and birthing at a hospital that allows you to do that. So yeah. But any closing remarks, Jessica? Were you going to ask something before?
I was just going to say thank you, Laura, for just giving us such a good timeline about everything. And I really want to say that, I really don't think it's a coincidence that after, you left that job, you decreased that stress, you got, spiritually, you grew, you baptized. I do not think that that's a coincidence, that is when you just start worrying about all the fertility appointments, that is when you conceived. And we have seen it countless times. We interviewed somebody, Gwen, and we have a podcast with her, and she was a nurse, and she finally quit her job, and right after that she got pregnant. She had a similar story to yours, just a high stress life. And sometimes stress becomes so normalized, especially when it's related to work in our culture. But for us women, especially women who are not 21, and trying to get pregnant, it's not okay. So whenever there's a way for you to modify your work environment or for you to just let go of some things that are causing stress in your life, it can make a huge difference on your overall health, but especially like your fertility, your maternal health. So I'm so glad that you shared that. And I just want people to highlight that as well. And that was like free for you to do, to like modify some things versus
Yeah.
for the money, you know, that you had to spend on appointments and stuff. Like when you just took control of it and let go of some things and had some time to breathe, and like Catherine always says, trust the designer. Like things kind of are intentional and they just roll into place. So I'm so happy that your beautiful story had this great end. And I also wanted to say this about endometriosis and PCOS. Those are two diagnoses that usually take years to be diagnosed. And like you said, you would not have even known, like this whole cascade of events would not have happened if it wasn't for like the CT scans that you had to get for something else. So that's why your story is kind of unique in that way. But a lot of people listening may have just went into appointments like you did saying my periods are too painful and got ignored, and they just dealt with it, you know, and then again they come back and then they finally years later get these diagnoses and they're able to get treatment. So y'all be like Laura and advocate for yourself and be a manager of your health and learn all you need to know about your body. Nobody is a better expert at your body than you. And just take control of your health and build the team that you need, whether it's an endocrinologist, a gynecologist, pelvic PT, a doula, whatever you need to have that birth team that you need to, you know, make your dreams come true. Do that for you and take control of it.
Absolutely.
Amen. Any closing words, Laura? You have the floor, and let people know where they can find you in your beautiful photography business as well.
Yeah, absolutely. I just, again, I'm really appreciative that God brought us together here today. I don't think it was an accident. It was obviously by his design. So I just want to thank you and thank you both for having me here to share my story. Like I said, it's definitely the journey that he's put me on is just one that I just want to shout from the rooftops, because he definitely has a plan and a purpose and a timing. And I just want all women to just be encouraged in that. Don't compare yourself to anybody near, around you and in your circle, because you are your own person and God loves you and he has a plan for you. So yeah, I definitely just wanted to, again, say thank you. I'm Laura Driscoll, Lola D Photography here in Columbia, South Carolina. I love people. I love taking pictures of people. So I'm an event and a portrait photographer. I'm on the board for the Professional Photographers of South Carolina, and also a member of the Professional Photographers of America. So I love what I do. I love people. So if you're interested in getting portraits, one of the things I love to do is take portraits of women that empower them. One of my favorite things is when a woman gets her portraits back and she just calls me in tears because she said, "I didn't know I was this beautiful." I said, you are so beautiful. The camera just captured it. I didn't do it. This is all you. And, so I love making people feel loved, and definitely love sharing love stories. So just capturing candid moments and pure joy and genuine love is one of my favorite things to do at Lola D Photography. So if that's something that somebody's looking for in Columbia, South Carolina, I am here. So just www.loladphotography.com. So that's LOLADEE as in Delta Echo Echo photography.com. I'm also on Instagram at LolaDPhoto. I am available for travel, and I love capturing people. So yeah, definitely contact me if you're interested. I just love loving on people and capturing those moments. So thank you again so much for having me. I am always here. I love supporting this type of education and advocacy. I love being able to be a voice for women, and I just love speaking out when things get presented that could help other people. So I'm always here. If there's anything else I can do for you guys, just let me know. Thanks again so much, Jessica and Catherine. I really appreciate your time, and it's been a pleasure.
Thank you.